Let's take a quick 1-minute tour through the IVF lab at RSC. One important thing to note is you can visit 10 IVF centers and find 10 right ways to do IVF. Our lab is divided into work areas, the first of which is the OR with a pass-through window between the operating room and the IVF lab. There's a hood in there to do retrievals, or we can do the retrieval right here. Next stop is the first of 3 micromanipulator stations. We use the micromanipulator for ICSI, assisted hatching, embryo biopsy, and embryo evaluation. We swing around to the andrology area where sperm samples are prepped for our IVF patients. There are 2 embryo transfer rooms adjacent to the IVF lab with a workstation in between. This is the second micromanipulator station with its adjacent hood. We're going to swing around this bank of incubators and find a third micromanipulator station. And finally, a work area for the cryopreservation and warming of eggs and embryos. And there you have it. Okay, can you hear me okay? Okay, well, thanks Nabil and the Progenesis team for the kind invitation to join this esteemed panel. Today we're not going to talk about the type of AI on the left that many of us learned in a world long ago and far, far away. We're going to focus on the type of AI at the right, artificial intelligence, where we are trying to replicate human intelligence with machines. Now, all of you know we could spend days talking about this, but we have 4.5 minutes. So I'm going to talk briefly about a tool that was introduced by Dr. Alexei Barash, who's there on the left. That's me on the right. My disclosure is that Alex knows way, way, way more about this than I will ever know in my lifetime. So I take no credit for this. I give it completely to him. Next slide, please. So we are all becoming more and more aware of uses for AI in the IVF lab, predicting success, predicting cryosurvival, laboratory performance, semen analysis, and potentially even patient dropout from cycles. Next slide. So Alex designed what we call a Pgt Calculator, and he used over 350 different fields, about 175 clinical and about 150 morphological and kinetic fields, looking at 3,000 cycles that we performed here at RSC and now compiled over 1 million data points with 150,000 process formulas going on in real time. Next slide. So using this Pgt calculator, we are able to tell a patient what your expected ongoing pregnancy rate might be from a given embryo. How many euploid embryos can I expect from my cycle? How many cycles do I need to do to get 1 euploid embryo based on my age? And how many eggs or cycles might be needed to get X number of euploid embryos for the purpose of getting siblings, etc. And one of the most important things is for setting correct patient expectations. Next slide. So in this first calculator, what is my chance of pregnancy, or which embryo am I going to pick? So you have the option of selecting age in a drop-down menu. I put 0 here because we know from our data analysis that age becomes irrelevant when we're selecting Pgt embryos. So for this particular patient, the embryo is biopsied on day 5. She has 1 embryo for transfer, and the embryo is a grade 4AB using the Gardner scale. So I know we have 82 FETs in the database, 64 IUPs, and that comes out to an 84% pregnancy rate for that particular embryo. On the next slide. So how many euploid embryos can I expect? Again, I put my age in here, 38 years old. I was at one point a long time ago. I got 12 eggs. And from that, using our data, we can expect 1.64 euploid embryos from that particular cycle. In the next slide. How many cycles do I need to get 1 euploid embryo? This is great when the patient who's 44 comes in saying, I feel like I'm 29. But she is 44, ovaries are 44, we get 5 eggs, and unfortunately it's going to take her, using this calculator, 8 IVF cycles to get one euploid embryo. Next slide. So Alex has termed this the Repro score, and he designed this other tool using all of these fields and calculations with machine learning to look at a patient's individual set of embryos and be able to predict which embryo would be the highest pregnancy rate for that particular patient. So in the search bar, you're going to put in the patient's medical record number, which we call the MPI for our EMR, and it has been whited out on the left-hand side. So this particular patient has 2 embryos from a retrieval date of October 13th, 2018. She has a day 5 3BB and a day 6 5AA. Both are female. And she's trying to decide which embryo to transfer. So one might be inclined to pick the higher quality embryo, but we know that from our data analysis that day 5 is probably over day 6 is the biggest determining factor for success for us. So the Repro score comes out at 74% chance of pregnancy. She did in fact have a successful pregnancy and a delivery. For us, this would be a no-brainer because we would pick the day 5 embryo anyway. But in the next slide, in the second example, this patient has a number of embryos of varying qualities, day of biopsy. Again, we chose the 3AB, embryo number 3, which was a female, at about a 91% chance of pregnancy. She also did, in fact, become pregnant and deliver a baby. One of the most important things, and I'm pointing at my screen, which is stupid because you can't see it, but is that even the aneuploid embryos have a high chance of implantation. So we do a lot of PGT in our center, and this does help us to select embryos. Next slide. So the future of artificial intelligence in the lab can be used to predict patient income. It does require, obviously, data security. It needs to be accurate. It needs to be low cost, it needs to be easy to use, and it needs to be trainable or flexible, meaning that it needs to grow with you. And we have found a way in our laboratory to use such a tool that really helps patients. It makes it easy for the clinician to have a discussion with the patient and to set realistic expectations. Next slide. Thank you. Wear your mask.